Hello, my name's Toby Shapshak, and I like to speak to interesting people about interesting things. And with me today is Noach, who is the CEO of this business you've probably never heard of called Discovery Health. How are you, Ryan?
Great, Toby. Great to be with you.
Discovery is such a fascinating company to me because as much as it's always going to be a grudge purchase, the bottom line is it's the necessary thing that we have to do in the world. And Discovery is a pretty remarkable business built from like literally nothing. You've turned 30 and you're no longer, there's so many divisions. You now have Discovery Health, Discovery Insure, Discovery Vitality. It's more than just health insurance, but it's actually built on pretty remarkable principles of if you look after yourself, you'll be fitter, healthier, live longer. So what is it, that people shoot the messenger instead of realizing we live in a situation where insurance is a no-brainer?
Some people don't like the 10 Rand copay in the pharmacy.
Yeah.
Or they don't like the fact that their medical savings account runs out and they're in an above threshold benefit. But when something serious goes wrong, there's nobody better in the world than Discovery Health Medical Scheme.
Look, I'm a happy customer and I have been for decades, so I can't really say what other health insurers are like, but my experience has been pretty slick.
But I think what makes Discovery Health and Discovery Health Medical Scheme quite different is two key features in my view. The one is that we're actually about shared value primarily. Imagine a world where we could have every single member exercising every day, eating healthily, doing the prevention and screening checks, understanding their risks, mitigating their risks. There would be much fewer health insurance claims. We'd be a healthier society. We'd be more productive. We'd be in a great space. And that is our ambition. And so our whole program is really focused on behavior change and on risk mitigation. And the second is that we have this very restless, innate, disruptive nature to innovate. We're only as good as what we did yesterday.
Yeah.
And so we've got to keep innovating, keep disrupting in a responsible way. And now that we have scale, now that we are a system of scale in the private healthcare system, that responsibility is even greater. We've got to make the healthcare system better.
My job is to see how technology works and how it makes people's lives better. And I'm always impressed at the back-end tech that Discovery has. Your data analysis is fantastic, but also you are pretty innovative.
We've done an amazing thing, unique in South Africa. We've integrated our banking system, Discovery Bank, with the healthcare system through Discovery Health's claims platform, completely seamlessly. So when you go into the pharmacy now, in the event that you do have a copay or you're in a gap, it just comes seamlessly off your nominated bank account. In my case, for myself, it's my credit card. And I get my little brown packet and I walk straight out the pharmacy. The customer journey is pretty spectacular. Walk in, walk out. And I think you'll struggle to find another system in the world where a banking system and a healthcare system are as deeply integrated to ultimately give the customer a brilliant experience.
I'm a Discovery customer and my experience is almost always really slick. I walked through the door the 1st of July last year and had a vaccine, It was a brilliant experience, and I know how much work Discovery put in to run the vaccine campaign in the background. And that's why I joke about, why do people hate you when they simply can't see what a brilliant job Discovery does. And it's not Discovery's fault or anyone else's fault that we need insurance, but I'm pretty happy with what I get, except when I hit the self-payment gap,
Well, that self-payment gap actually is quite important, right? It engages one's brain around your day-to-day spend. And it does lead to a change in utilization patterns and thought processes around all day-to-day healthcare. But speaking of the vaccination campaign, just to reflect personally for a moment, it is fundamentally iconic of the reason why I get out of bed every morning. I feel like we have a responsibility to society, and at massive expense, with huge inconvenience, everything was put aside to make sure that we did the right thing for society when it came to vaccination. And I'm inordinately proud of it. So I think it gave our people and me personally a reason to be. It felt like we were doing the right things aligned to our core purpose to enhance and protect people's lives. It was a very important moment in time, great privilege for us.
There have been some fundamental changes in the world because of a 2-year pandemic. What are some of the things that you've seen in terms of the way people use Discovery and your healthcare services?
Our primary reflection on COVID is what a tragic period it was. We lost 17,000 customers in Discovery Health.
Sure.
To direct COVID deaths. And
Sure.
That's not counting the indirect impact. So the starting point is just to say that there is a particular tragedy that we've all lived through with huge consequence to our mental well-being and our family units in our society. I tell you hand on heart, I think actually the healthcare system is better. The big changes, which would be right in the heartland of your personal interest area, is largely on the digitization of healthcare.
Yeah.
It was an emerging trend in years prior. It was a personal passion of mine. Everybody was talking about it, but engagement levels were really low. We just couldn't get them to adopt digital healthcare technologies. And that changed dramatically through COVID by need.
Yeah,
it was forced on us.
Yeah.
So people saw their doctors virtually through virtual consultation platforms. And those have been formalized through telemedicine platforms. We've built one and rolled it out to doctors in South Africa. So you can see your doctor virtually. It's quick, it's accessible.
I think that's brilliant because my GP, a genius called Sam Fee, is in her own way a pioneer of that kind of way. I mean, you and I used to communicate via WhatsApp, and it's the obvious way that this will go, because ultimately it's just better for everyone involved.
And it triggered the need for so much change. Sam Fee, who I happen to know as well, quite coincidentally, and for those listening, Toby and I didn't line that up beforehand.
No.
Sam Fee came to us with a group of GPs, forward-thinking GPs, to say, look, we're delivering care so differently, but we only get paid when we have a formal consultation with the patient, and we can't sustain our practices this way, right? So what we did during COVID very quickly, in a matter of a couple of weeks, was we came up with a whole new payment framework. We said, we'll pay you as GPs for 2 weeks of an episode of care for somebody who's dealing with an acute COVID illness. Once they're diagnosed and you are their treating provider, we'll give you a fee to look after them at home and out of hospital for 2 weeks. I'm just trying to give you a sense of how much changed in the healthcare system. All of a sudden...
I'm impressed to hear that, because that's exactly the change that was needed.
Yeah, suddenly you're not paying per visit anymore. You're paying for an episode of care and hopefully a good outcome.
Yeah.
And that's a much better way to pay for healthcare. We call it value-based healthcare.
Yeah.
Or outcome-based reimbursement. And let me give a different perspective. You say you don't like the word shared value, but I mean, it is a good descriptor of what it is. I mean, the policyholder benefits because hopefully they're healthier.
Yeah.
And better health leads to a whole lot of things. I mean, that's proven in the evidence. Longer life, much more happiness, stability, a whole range of things, better mental health, and so on. The insurer hopefully gets less claims as a result, and therefore is more sustainable. What do we do with the fact that we got a better performance than other insurers? We do two things. The first is you've got to drive that cycle faster. So you've got to pay healthcare professionals an incentive and a bit more to keep the members healthier. So we do that in the first instance. And the second thing you do is you've got to try and reduce the cost of medical insurance, which is very expensive wherever you go.
Yeah.
So you've got to pass back some of the discounts to consumers. So I think by definition it is shared.
I totally agree with you. I just think the phrase just doesn't capture it for...
What would you call it?
I don't know. I wish I had a good answer, because then I'd sell it to you for a small fortune. But it's like there's something in the phrase that people don't understand how much value they're actually getting. I've seen other services. I've seen what you get. I've done the number comparisons. You get a lot for what you pay for, and it's reliable and it works, and if the proverbial hits the fan, you're covered.
So let me surprise you here for a second. Let me tell you about my own anecdotal experience.
Okay.
So I'm probably not representative of the average Discovery Health consumer, because I'm very engaged and I'm a fitness fanatic.
I didn't notice that about you.
So thank you. I'll take that as a compliment. So I am highly engaged, and I exercise 6 or 7 days a week. As a result, I'm getting those active rewards rings closed, and I'm earning quite a lot of Discovery miles, and I'm on Discovery Bank and Discovery Health. And here's the surprise. I get my medical aid for free every month from Discovery Health Medical Scheme. Doesn't cost me a rand. Because the money I get back for the lifestyle I want to live anyway, it more than pays for my health insurance premium for my family every month, and it gives me some surplus. So in my case, the shared value actually gives me my excellent health insurance cover at no cost.
Yeah, I mean, that's the value of the system. Behavioral economics really works,
But I'll tell you the societal challenge we face in the kind of domain you're talking about now. As a leadership team in Discovery Health, we believe we have an obligation to extend access to good private healthcare to more South Africans.
I've seen some of your packages. You got some very clever packages for the a whole different section of society.
We have got to innovate and use our scale in the healthcare system to make private healthcare more accessible, and do that through proper financial services products that can be supported by employers and can be bought by individuals that really do avail good primary healthcare. If we can do that and extend beyond the 9 to 10 million people that currently have medical scheme cover, then I think we're doing something meaningful for society.
I'll tell you one of the things I've seen you launch recently that I think is really impressive is this hospital at home idea. So my mother was in hospital pre-COVID. I spent 2 weeks at Donny Gordon and then another 2 weeks. And it's kind of terrifying what superbugs have become. And we saw that a lot during COVID. People would go in with one thing, catch something else, probably COVID, and not have a good outcome. I think that's quite a good idea, in the same way that I think telemedicine is a brilliant idea.
Yeah, we are absolutely so excited about hospital at home. It's a global trend, and here in South Africa, we're leading. But it is emerging all over the world, and COVID precipitated it. One of the big things COVID did in healthcare is prove that care can be delivered in non-traditional locations.
Yeah.
Doesn't always have to be in the traditional location of the doctor's office or the hospital. It can be delivered from home, or procedures done in day surgery centers and other out-of-hospital settings. So this hospital at home business is fascinating. We've built a remote monitoring platform in partnership with an American company called Bioformus, who we think has got the best remote sensing technology in the world. You get hooked up to it at home in your bed. Your next of kin get trained. The nurse visits you 2 or 3 times a day at home, as if you're in the ward.
Yeah.
Your drips and your medicines and all your monitoring happens at home. We've got a 24/7 command post staffed by ICU nurses and doctors who are monitoring all your readings all the time. Better monitoring than you get traditionally in a general ward. And your consultant, your specialist, dials in and does 2 ward rounds a day, virtually, but not in person. It's quite astounding if you look at the evidence. Firstly, the patients are much happier. They feel much more satisfied. The next of kin feel like they can play a much more meaningful role. The sleep patterns are much better. The health outcomes are as good, if not better. The safety outcomes are better.
Yeah.
The hospital-acquired infection rates are lower. The evidence is showing this really works and is good for patients. Don't confuse this with just home care.
Yeah.
This is somebody who would have been admitted to a hospital with a pneumonia for antibiotics and a drip and oxygen. Now we're giving the antibiotics and the drip and the oxygen at home with the monitoring. So it really is hospital-level care at home.
It's what I see about Discovery. It's actually a remarkably tech-led company, but you've got a very slick interface so that it looks really simple. The apps and the services are really simple from a consumer perspective, but the complexity of the technology behind it is pretty huge.
My personal view is it's not simple enough yet. I think we've still got work to do to manage that complexity better in the background and ensure that UX, that user interface, is absolutely simple and friendly, and we're working hard to keep improving that. So pleased to hear you find it easy. Not everybody does, and we want to keep working very hard to improve that.
Thank you, Ryan. I'm going to leave you to get back to work. My name's Toby Shapshak. Thank you for watching Stuff. You can read more on stuff.co.za.